To protect infants from a dangerous respiratory virus. There's a new drug for RSV. It's really been hard to find this fall, but we're now learning it could get a little easier.
Here to explain is Dr. Kristen Moffitt, infectious disease specialist at Boston Children's Hospital. It's great to see you, Dr. Moffitt. Thanks for joining us. So you're right there. You're on the front lines. Set the scene for us. What's happening with RSV right now, and are you starting to see cases?
Yeah, we're seeing plenty of RSV. We started to see cases really at the end of September, but saw a pretty steady rise in the number of cases throughout October and throughout this first part of November so far. I think recently our test positivity numbers for RSV testing are somewhere between 20 and 30% positive. So we're seeing a lot more RSV right now than we are influenza, which tends to come a little later than RSV. We're seeing a lot more RSV right now than SARS-CoV-2. And we're seeing plenty of respiratory viruses that test negative for all three of those viruses as well, but plenty of RSV.
So as you know, doctor, you have this new drug, a monoclonal antibody to prevent the most severe symptoms. Why has this been so impossible to get?
Yeah, I think the short answer really, Maria, is that the demand has far exceeded what the expectation was. I think we need to remember that this monoclonal antibody only had its full approval a couple of months before the start of the RSV season, and it was initially approved for all infants under the age of 8 months coming into the RSV season. And then the demand for it has just far exceeded what was expected. Therefore, we're in relatively short supply. So since we're in short supply, the recommendations have changed to really prioritize giving the available doses to the highest risk infants. So that includes the very young, under 6 months of age, and that includes those who have an underlying condition that puts them at increased risk for severe RSV infection. So that includes underlying lung conditions, some congenital heart disease, and immunocompromising conditions.
Dr. Moffitt, the CDC announced this afternoon it plans to release 77,000 more doses to physicians and hospitals nationwide. So that seems like a large number, but how many could you use at Children's?
Yeah, I think it's really hard to say, but I would say it's probably on the order of a couple hundred and not thousands that we could use here. But again, this really needs to be shared equitably across the country. So there's lots of places that could use these doses. I would like to assure parents, though, that there are other ways to protect their children from RSV, their young infants from RSV. A woman who's pregnant in her 3rd trimester may be eligible for the maternal RSV vaccine, which demonstrated excellent effectiveness at preventing severe RSV infection in infants in their first 6 months of life. We still have a monoclonal antibody we've been using for years. It needs to be given monthly, but that also has been used and is effective at preventing severe RSV in children with underlying conditions that put them at increased risk for RSV. So parents should absolutely talk to their providers about those options if they're having a hard time finding the other monoclonal.
Great reminders there. Dr. Moffitt, thank you so much. We always love to see you. We appreciate it.
Take care, Dr. Moffitt. Have a great weekend.